I want to go over some very important medications today, a couple life-critical medications and some other medications I feel are good to have in stock and also have backup supply of. The first medication I'm going to go over is the one you see in front of you. The medication or chemical within this device is called epinephrine. This is what's known as an EpiPen. This is something that is very familiar to those who have severe allergic reaction, and maybe not so much to the rest of you. When I say severe allergic reaction, I'm not talking about just a little bit of sniffles and kind of the itching of the eyes, that kind of thing, but to rather complete respiratory distress, loss of consciousness, that kind of response, which, there's a spectrum of kind of reaction you can have to an allergen, something that causes a reaction, allergic reaction. But in the most severe case, it is life-threatening, and the only go-to medication in that case is going to be epinephrine. In fact, that's what they will be administering in the hospital, along with some other things, more than likely. But the most often go-to and the most critical medication is epinephrine. This is a self-administratable device. Basically, this gets punched through the skin into the muscles. There's a small little needle that actually extends out once force is applied to this, and that delivers a prescribed dose of epinephrine. Results in vasoconstriction. What's happening during your anaphylactic reaction is vasodilation. Your blood vessels are dilating, basically increasing in size. That's leading to some lowering of the blood pressure, some leaking of that fluid into the surrounding tissue, and really bad case, the lungs become filled with fluid. So you're drowning your own fluid, causes constriction of the throat from all that swelling, which can cut out your air supply. Your throat basically closes up. So obviously, that's some pretty serious stuff, and this is the one medication that is effective in that regard. So things to note with this, always be mindful of your expiration date, which is listed on the side here. Also, what's nice about these pens is they do include this small window here, which says right here, replace if solution is discolored. Very clear instruction. Basically, you have two abilities to check here, both with the expiration date as well as visually. If the solution looks discolored, that's a clear indication that this is not the device you want to be using, because it probably won't be as potent as you need it to be, and therefore not as effective. And this is, once again, a critical medication. If it's not at its maximum potency, it will not produce the necessary desirable result. So very important that you're checking, if you do have one of these, that you are checking to make sure that your expiration date, you're within your expiration date, and also that the fluid itself is not discolored. You should ask your doctor for a prescription for a couple of these, or a couple prescriptions, whichever the case may be. Always have backup supply of this. And if you do require this kind of intervention, you should always have one of these with you, one in the car, one in the home, that kind of thing anyway. So that's the EpiPen in brief. Very important medication to have for those who need it. Another medication that kind of goes hand in hand with that is good old Benadryl, or diphenhydramine. This is the brand Benadryl. The medication itself is diphenhydramine. It basically works in combination with epinephrine, but this is really your go-to. This is your first-line treatment for anaphylactic shock, whereas this kind of helps with some of the localized or capillary bed, so the small vessels, the smallest of the small vessels in your body tend to release extra fluid in response to some of the cells around them releasing something called histamine, which is a chemical that's in our cells. It gets released in response to an allergen, something that causes the allergy, causing a lot of localized swelling and makes you really uncomfortable. That's when you get the hives, or those raised areas of skin during an anaphylactic reaction. Also cause a lot of itching. That's kind of what we feel when we're experiencing that. Well, Benadryl helps to kind of counteract that whole experience. So not necessarily a life-saving medication, but will make you feel comfortable. This is really your life-saving medication. They both go kind of hand in hand when treating an anaphylactic reaction. Okay, enough about those two. Another medication, now this is just a vial. It's simulating insulin. It's just a dummy medication vial. Insulin, for those who require it, is a life-saving medication. This is something that is much like the other medication, perishable. You always want to make sure that the expiration date is adhered to, that you do have backup stock, because you don't want to be without. In the event of a resource depleted situation, you don't have access to these medications for reason of the pharmacy being out of stock, the manufacturer being I don't know, having a production problem, or just inaccessibility to these medications for whatever reason. You want to make sure you have backup for that reason. Insulin, for those who are diabetic, insulin dependent diabetics, management of your sugars is critical. If your sugars get too high, obviously just on a routine basis, if we're not maintaining that, we're causing obviously blood vessel and nervous system damage. But in an extreme, when our sugars get way much too high, we're talking about DKA, or diabetic ketoacidosis, which is a very bad thing. For those who are diabetic and insulin diabetic especially, you're aware of that. We never want to let our sugars go to that extreme because the results are always fatal. So in addition to managing our sugar levels through diet, insulin is very important. Having a ready stock of this, making sure once again that the item is at its most potent, that is making sure that the expiration date is adhered to, storing these items in a cool place, not in a place where there's extreme heat, so that these medications tend to degrade when exposed to very warm environments, in the glove box of one's vehicle, things like that. You want to keep these things kind of in a cool, dry place. The instructions are very clear with all these medications. I think a lot of times people don't tend to read those things, or maybe just look at how to administer and don't look into all the additional details. But these things are important as well. So those are the two or I should say 2 plus 1, and I'll call Benadryl not exactly a life-critical medication, but it definitely will, once again, work with the epinephrine to help counteract the symptoms and the experience you have with an allergic reaction. So now moving on to other medications I think you should have in stock. A couple here fall in the category of NSAID, or non-steroid anti-inflammatory, NSAID. So non-steroid anti-inflammatory drug. I have two different types here. I have Aleve, which is a brand, and I have the generic form, which oftentimes people are familiar with Motrin, but we're talking about ibuprofen. So, and in the case of Aleve, we're talking about a medication called naproxen. Both fall into the same family of medication that is called non-steroid anti-inflammatory drug, as I just mentioned. I have both of them here because they both do pretty much the same thing. The Aleve works a little longer, and as the commercial says, and it does. It works upwards of about 12 hours, where ibuprofen is good for about 6. So I'm sure there's studies that maybe demonstrate one to be a little more effective in some regard than the other. I tend to feel they're both equally effective. I just like the Aleve, my personal preference of Aleve, because it is a little longer in its duration, how long it works for. Things to know about both of these medications is that they work on several different things. They work as an anti-inflammatory, so they reduce inflammation or swelling. Swelling leads to increased pressure, leads to increased pain, so that helps out tremendously for those who have any kind of, say, an injury resulting in swelling. It cuts down the inflammation in that sense, therefore decreasing pain. They also help with just general pain. They are analgesics, so they work on the pain receptors, alleviating general pain, that is. They also counteract fever. They're effective in that regard as well. Fever is not something that we need to treat. We're taught by mom to do so, but in the medical profession, we oftentimes don't, unless the person is truly uncomfortable. Oftentimes, we're not uncomfortable with fever, but for those who are, the other reason is if increased fever leads to increased metabolic rate, which leads to an increased demand of oxygen. So a patient who's already requiring oxygen, that'll increase the demand even higher. So we tend to treat fever for that reason. Increased heart rate. Also, for a patient that we're not trying to, we don't want to stress the heart. Fever can lead to an increased metabolic rate, so the increased heart rate, and sometimes we'll treat it so that it lessens the demand on the heart. But it's not too often that for somebody who otherwise is healthy, we would need to treat fever. Fever actually counteracts viral shedding and the development of the bacteria in the body, the ability for the bacteria to multiply. It limits that, so it's actually a very beneficial thing. We just unfortunately tend to treat it a little too aggressively at times. I didn't include Tylenol because I don't actually have any Tylenol. Tylenol is also effective. I personally prefer ibuprofen over Tylenol. Tylenol has a less safe index. Overdosing with Tylenol has occurred. I think that you hear more and more stories about a lot of studies and reports about Tylenol overdosing. And you can overdose on these medications as well. They tend to have a safer index, however, and they're more effective comprehensively. Like I said, non-steroid anti-inflammatory. I've got old knees that act up after I hike long distances, things like that. This is far more effective than Tylenol for me. However, for people who have renal problems with their kidneys, who are in kidney failure, this is not the medication you want to use. For persons with bleeding disorders, say an acute bleed, say you just have a severe bleed of some sort, you've just come out of surgery, and this is not the medication you want to be taking. This actually interferes with platelets and therefore clotting, and can lead, if you have a bleeding disorder or something like this is not the medication you want to be taking. Because it can affect your blood's ability to clot, whereas Tylenol doesn't. So there are sometimes indications for Tylenol, but for the most part, I stay away. One more thing about Tylenol. Tylenol is included in a lot of the cold and flu medications that you'll see out there. The ones that have several different compounds that treat cold and flu. Those doses of Tylenol in those medications tend to be extremely high, about 800 milligrams per dose. Really be careful, folks, when you look at the packaging of any of that seasonal flu and cold medication. It's very easy to overdose on that stuff because you're feeling like crud during that experience. And if you're not spanning out the time between those doses as indicated, every 6 hours in most cases, and you're taking it too soon, you could be taking too much Tylenol within a 24-hour period and causing damage to your liver without you even knowing so. So keep that in mind. I think that's an oftentimes overlooked thing. Moving along here, another medication I feel is important to have on stock is loperamide. Here this is anti-diarrheal. It comes in many different forms, several different brands. This is a generic. This is simply Walgreens version of loperamide. In times of, say you're having some kind of gastrointestinal or, as we say, GI distress, this is an important medication to have on hand. If you're having diarrhea and therefore you're losing a lot of fluid, diarrhea and fluid loss, dehydration results, and that can be very serious. If you can't hold on to, if your body is just basically pushing out all the fluid through diarrhea, and you're not making up for those losses, you can become very sick in terms of being dehydrated, and it could lead to death in an extreme case, especially if there's vomiting along with the diarrhea. Something like this actually counteracts diarrhea. So you end up, hopefully, if it's effective in that case, it will limit the amount of diarrhea and therefore limit the amount of fluid loss. And hopefully over time you'll work through it and whatever is causing the diarrhea, and you will not become dehydrated. In the extreme sense in dehydration, we in the hospital give IV fluids, so administer those fluids directly into your system through an IV. But at home, obviously, you don't have that benefit. So hopefully you can control the diarrhea, the fluid loss through something like this if it becomes extreme and you can't hold anything down. But a good medication to have. Once again, maybe a little extra in stock in the household. So if ever there's a case where, resources are depleted, you don't have access to them, it's a good medication to have. not necessarily what I'd say critical medication, but a good medication to have. So once again, the critical medications, certainly epinephrine, Benadryl, a good thing to have as well, and insulin for those who are insulin diabetics. All right, very good. That's pretty much it for me, and hopefully this was helpful for those of you who need this information, and all the best. Bye-bye.